I want to start with acknowledging the Lekwungen peoples on whose traditional territory the University of Victoria stands, as well as the Songhees, Esquimalt, and Wasanic peoples whose historical relationships with the land continue to this day. That yellow circle is around where the university is. I feel like it's particularly important to acknowledge this when we're talking about substance use and alcohol policy, as these are things that have disproportionately impacted Indigenous people here in Canada. We have folks tuning in from all over, so if anyone feels like they would like to share which land and territory they are tuning in from in the chat, please feel free to do so. I wanted to take a moment and turn it over to Tim Namey, our director, to say a few words about Harold Johnson, who passed away earlier this year and was a big contributor to the CAPE project, and his wife Joan is on the line today to share some of their work on the Northern Alcohol Strategy. So Tim, would you like to say a few words?
Yeah, thanks, Amanda. Well, you sort of did it, but we really wanted to acknowledge and reflect on the late Harold Johnson, who was, really a giant in actually many dimensions. But we remember him especially today because of our focus on alcohol strategies. And Harold and Joan, his wife who's here today, did so much work on the Northern Alcohol Strategy that you'll be hearing about in just a little bit. But very brief, biographically, Harold was born in northern Saskatchewan in Treaty 6 territory. He had a number of interesting, to me, roles. He was a trapper, a smelter, a trade unionist, a writer, and a miner. He then up and went to Harvard Law School and came back and for many years served as a Crown prosecutor in Saskatchewan. As you'll hear again, he was very involved and a strong advocate for alcohol policy. But he also understood harm reduction. He was intimately familiar with those with lived and living experience. And he also really understood the limitations of legal approaches to preventing and addressing alcohol problems. And on a personal note, well, he was an author of many books, but his book called Firewater: How Alcohol is Killing My People and Yours is the best book I've ever read on alcohol, and one of the best books I've ever read. So my contribution today is to urge all of you who have not read Harold's book to consider that. And last, as Amanda alluded to, we are honored for Harold's help and support with CAPE. Right up until his untimely passing, he was involved, and he was set to speak at our very first webinar, but unfortunately he wasn't able to. So we're thinking of him today, and I'll turn it back over to the next presenters.
Thank you, Tim. Appreciate that. Just a few quick housekeeping rules. We're going to have an introductory presentation by Norman Giesbrecht, a keynote by Robert Strang, and then a panel discussion featuring 4 panelists. And then a Q&A at the end. It's a lot to get through in 90 minutes, so hopefully we can do it all. We're going to be recording the presentations and the panel discussion, but then turning off the recording for the audience Q&A session. When we will be circulating that recording and some other materials after the webinar. If you're having any technical difficulties, please send me a direct message, or Tina or Nicole or Kate. Just drop us a note. We'll do our best to help you out. If you identify as a person with lived or living experience, we do provide stipends for attendance. If you indicated you were in this group when you registered for the CAPE COP, you don't have to let us know. We track the attendance. We'll know if you were here or not, so you don't have to keep re-identifying yourself. And then we also have French translation, simultaneous translation again today, thanks to Julie. Here's a quick guide as to how to access that. And we will be highlighting the panelists and moderator during the panel segment, so it should be easy for you to keep track of who's talking and when and what they're saying. So once we get to the Q&A section, please use the chat box to submit a question at any time. If it comes up while somebody's talking, and I'll be kind of moderating that section. So I'll be doing my best to look back at questions that were asked earlier in the session and making sure that they are brought to the panelists. If you prefer to ask your question, and I will be reading the questions out too, so everybody can hear them. If you prefer to ask a question by speaking, which is totally fine, you can put up your hand and then we can get you, ask you to unmute when we call upon you and you can ask the question. Whoops. And if you would like to ask an anonymous question, which is also totally okay, please just send me a direct message and I will read it out and not attribute it to you, because I know that some people may be uncomfortable asking questions publicly, and that's totally okay too. So I have the wonderful pleasure of introducing Norman Giesbrecht, who has been, you've probably seen him on quite a few of these sessions. He's often doing what I'm doing right now and introducing our speakers. He's an emeritus scientist with the Institute for Mental Health Policy Research at CAMH. And he was a founding investigator on the CAPE project team for the first iteration, which was in 2013. So he's been part of CAPE since day one. He's served on numerous national and international teams over the years, and his career has been dedicated to producing high quality evidence-based research to reduce and prevent alcohol-caused harms. And we are so happy to have him on CAPE again. And he's going to speak a little bit about alcohol strategies to give an overall overview. So I'll turn it over to Norman.
Thank you very much. The first slide, please. So what are the purpose of alcohol strategies and action plans? Well, they can help guide efforts to coordinate and prioritize policy initiatives and interventions under government leadership. They should aim to address the goals of the WHO global strategy to reduce the harmful use of alcohol to 2022. There have been recent examples, including Scotland's alcohol framework of 2018 and Ireland's Public Health Alcohol Acts of 2018. And I think all of the WHO, the Scottish and the Irish documents are going to be posted on the chat line. Next slide, please. So I'd like to highlight a couple of the best practices with regard to strategies. They should be a standalone alcohol-specific strategy or action plan, not buried under, let's say, a mental health plan or a drug plan with a brief reference of alcohol in it. It should include a range of evidence-based policies, and I'm including the list here from the CAPE project, and you can see them there. I won't read them out. There's 11 items, and it should be developed and implemented free of alcohol industry influence and involve coordination, leadership, endorsement, and dedicated funding. And there should be mechanisms in place for monitoring and for documentation. Next slide. Now here's the situation currently in Canada. As you can see, there's some jurisdictions that have active strategies. Newfoundland and Labrador, Nunavut, Northern Alcohol Strategy in Saskatchewan, and under development in Northwest Territories, in discussion PEI, not active Alberta, Manitoba, and the federal national one, and not known or places not known or not unknown. BC, Yukon, New Brunswick, Nova Scotia, Ontario, and Quebec. The National Alcohol Strategy, NAS, recommendations have never been endorsed by the federal government, although Health Canada did provide partial funding for its development. The NAS did not exclude input from the alcohol industry and did not include recommendations for all relevant alcohol policy domains that are listed in the previous slide. Next slide. I'm now very pleased to introduce Dr. Robert Strang. Many of you may have seen him on TV and on radio, heard him on radio during COVID-19, where he often talked about the initiatives to control the spread of disease and mitigation measures. Dr. Robert Strang is a public health specialist physician, the chief medical officer of health for the province of Nova Scotia since 2007. He advocates for policy measures that create environments supportive of health and that reduce alcohol-caused harms. He was involved in the development of Nova Scotia's provincial alcohol strategy published in 2007 and is a member of the National Alcohol Strategy Advisory Committee. Dr. Strang.
Good afternoon, everybody. Really appreciate the opportunity to join you today. It's a pleasure. Those of you who don't know Norman, I want to thank you personally, Norman, for your tremendous leadership over the years, and you continue to be involved in this important issue. So thank you. And I want to thank each and every person participating. Your commitment to this really important issue and trying to make a difference is important. Thank you for that. This can be very challenging work as well, as you're all probably well aware. I'm going to speak to you briefly, kind of three areas: my experience, both at a provincial and national level around alcohol strategies, the opportunities of, the importance of alcohol strategies, especially right now, and what opportunities we may have to help advance comprehensive approaches to reducing harms from alcohol. So I've certainly been involved at a provincial level, developing the so-called Nova Scotia alcohol strategy. But I think there's a few lessons learned from that, because really that was an alcohol strategy developed by the then Department of Health Promotion and Protection, led by colleagues in mental health and addictions branch, and then certainly involved people from public health. But the reality is that that strategy never moved beyond a single department. It was never adopted by government more broadly. Never had really any substantive impact on policy other than an immediate discussion a number of years ago as a result of some significant events on cheap drink nights, where we were able to create a minimum drink price for alcohol in Nova Scotia. But that's the only significant policy issue we were able to really move forward. And I think there's a couple of reasons there. That lessons that I take is that it was a strategy that by necessity that touched many parts of government, but it was not developed with their engagement, and so there was no ownership by whether it's Department of Finance, and many other departments that were involved. So, and then more importantly, is it was developed, based on what the evidence would say, what an appropriate policy framework should be, but there was no public engagement. And as I'm sure you've all experienced, that moving alcohol policy forward is challenging. And I really believe that alcohol policy needs to come from the grassroots up, that elected officials this is a very contentious area, and unless they're getting a strong voice from communities that something needs to be done differently around alcohol, this is an area that they're not going to delve into. So I think no government engagement and more importantly, no community engagement was really why that strategy really stayed as a document produced by the Department of Health Promotion and Protection, but really didn't go any further than that. I've also been involved since 2000, and I believe it was going back to 2008 or 2009, and representing the Council of Chief Medical Officers of Health at the National Alcohol Strategy Advisory Committee. And as Norman has mentioned, I think one of the key challenges there was the presence of industry at the table. And a number of us from the health side were very pleased with their more recent restructuring of the National Alcohol Strategy and the Advisory Committee, where the alcohol industry has a chance to have input, but they are not part of the Advisory Committee. Having them at the table as part of discussions about where the strategy might go, gives them information which that was then used away from that table to influence elected officials, decision makers. And while we don't have definitive proof, it certainly the strong sense from people from inside and outside of government on the health side was that that having them, that their position at the table was then used to delay or stop some significant activities that were hoped to move forward through the previous national alcohol strategy. So I think there's significant lessons learned about, yes, the voice of the alcohol industry needs to be given a place to provide their perspective, but very careful about where and when they are engaged. I've also been very much involved through my career, really, in terms of tobacco control, and there's a couple of lessons that I think are relevant there. Much of this work and the success in tobacco control, and there have been substantive successes since the year 2000, substantive reductions in smoking rates across the country. But much of that started at a municipal level, started with community voices asking for things to be different, and many times the first decision makers closest to the ground, you can start at a municipal level. So I think there's things that is a lesson learned about maybe we need to be starting more and moving things forward, getting momentum by starting at a municipal or regional level. The other lesson is really, once in tobacco control, once there was solid evidence around secondhand effects of secondhand smoke, that really allowed tobacco control to really pick up momentum, because it became an issue not just about the individual smoker and the harms that they are suffering, but many others who weren't smokers. So I think we need to understand, get more data and information, but I think the concept of how do we, what is the impact of alcohol use on our broader communities, on families, really, what are the secondhand impacts that we all bear the burden of, if nothing else, as taxpayers. And I think that's an important way we frame it as well, to start to get more traction around alcohol policy issues. So what do I see now as the importance of having a comprehensive alcohol strategy? I think on a couple of issues, it helps really to articulate, we have, what's going on right now, that we have, well-established information on for a long period of time on the known harms, a broad range of harms that alcohol creates. But I think in front of us right now, we have two issues that can perhaps be opportunities to leverage. We certainly know that one of the unfortunate consequences of COVID has been a significant increase in the use of alcohol and other substances, but also all of our health systems across the country. And I say that deliberately because we have 13 different health systems in provinces and territories, are all under extreme pressure. So I think there's an opportunity to anything that can decrease demand on their healthcare system should be an important issue that is put forward publicly for discussion. And I'll just use the example of Halifax right now. There's been a lot of discussion around, it was delayed because of Hurricane Fiona, but there's meant to be the Dalhousie homecoming, and significant concerns about the potential for impacts from large student parties, off-campus parties, having impacts on already highly stressed emergency rooms. And that's just one example, I think, but there are opportunities on how do we frame our current situation that allow us to say we need to take some action, or at the very least, we need to engage communities to say, this is the status quo, here's where we're at, here's the impacts that are occurring, and are we okay with that? And if we're not okay, how do we have a conversation then about what can we do differently? I want to recognize, I think, the importance of having a comprehensive approach is really important, based on evidence, to be able to put that forward ultimately to communities as part of that conversation. So if you want to do something different, here's what it looks like, as well as the decision makers, because we know that this is a complex issue. There's many different pieces that have to be part of a comprehensive strategy. If we don't if we're not articulating a comprehensive approach, then we're going to the low hanging fruit is likely to be the things that are picked off, and usually that low hanging fruit, it's easier to do. It likely doesn't have the level of impact ultimately that we want to have. And I've seen that already with, even if we do put forward a comprehensive strategy, discussions I've been involved in around previous evaluations of alcohol policy across the country. The responses being, well, what are the things that we're the worst at, and how do we change one or two things to make it almost appear like we're doing something, rather than saying, let's look at a comprehensive approach. So I think that the point is that it's challenging to get buy-in for a comprehensive approach, even if you can put forward a framework. But without a framework, you'll never get that, and you'll have people, cherry picking very, single initiatives rather than a comprehensive approach. And I do want to acknowledge, I think the work of CAPE is really important. The putting forward that comprehensive approach. What are the 10 kind of key areas you should focus on, but also having that evaluation component. It's very helpful to put something in front of decision makers and say, we're failing in several areas, especially when you can compare to other provinces and territories and say there are other parts of Canada that are actually doing better in this area. So having that evaluation and comparison is extremely important to continue to move this work forward. And let me finish and just give a few reflections on where I see other real opportunities are to actually start to really have gain momentum and really move forward on a comprehensive approach to reducing the overall harms from alcohol. One is we have, there's the discussion around the revised low-risk drinking guidelines. They're out for consultation, and we expect middle of November the finalized version will be released. Maybe I'm biased. Well, I am biased because I'm on the advisory committee for that work. But I think the way they framed it is really important, that it's about simply giving Canadians information to help guide their choices as the primary objective. And allows you to stick very much to the science. What does the latest science say about the harms that result from alcohol use? You're not making a judgment about whether people should or should not use. It's just let's help you be informed, help Canadians be informed. But then it also automatically then leads you into conversations. Well, how do we inform Canadians beyond just having information about the low-risk drinking guidelines? They need information about what a standard drink is. They need information at point of use in terms of what are the potential harms, cancer warnings, and those kind of things. So it opens up some policy conversations as part of that. How do you inform Canadians? And I think that's an important place, because we need to get momentum, and sticking in that information objective helps you get away from some more contentious areas where we're really trying to control people. We're prohibitionists and all those kind of issues that come up, and certainly the alcohol industry will use those kind of things. So it keeps us, I think, is an opportunity to gain momentum by a very constructive framing, if you will. I think we can also look at the federal government has just now released, they're going to be starting a consultation on the cannabis legalization. There is a risk in that, because I've seen pressure that from the industry, they want to open up the ability to strengthen marketing and all those kind of pieces. So there's some work to do from a public health perspective about keeping our strong approach that we've taken with cannabis. And also what we've done over decades with tobacco. And both of those, I think, really give opportunity to say, well, why is there such a contrast between what we allow in terms of marketing, labeling, et cetera, for alcohol compared to cannabis and tobacco? So I think those are, to me, those comparisons, we always need to be putting those out there and going, well, why? Are we okay? Are we okay with that? But on top of that, I think we've made great progress around still lots and lots to do around advancing harm reduction approaches related to substance use. So I think we always need to look at, as we're advancing alcohol policy, we always need to have ultimately a harm reduction approach. And how do we accept that people are going to use alcohol to some extent? Some will have heavy drinking patterns, some won't have any. But how do we, as we're doing policy, making sure that we are not creating greater harms, especially for those who are most marginalized, may have the heaviest patterns of use, and we're not increasing their risk as we take a comprehensive approach to alcohol. And I think we can learn a lot, the advances we've made. Again, still lots of work to do around other, street drugs and all those kind of things. A harm reduction approach is much more familiar to elected officials, to the general public, and even within public health. I think, as I mentioned before, that the state of our healthcare system gives us an opportunity to say, we know how much overuse of alcohol, both acutely and chronically, how much of a burden it puts on our healthcare system. So it gives us an opportunity to say, well, we need to make some changes, and here's how you would make those changes from the evidence around alcohol policy. That certainly allows us, I think, to gain or reach out to elected officials, decision makers in the healthcare system, whether it's regional health authorities, departments of health, health ministers. But it also, I think, is an opportunity to try to mobilize voices of healthcare providers, like was done with tobacco control. The voice of doctors, nurses, and others was a very important part of advancing tobacco control policies. And I think there's lots of room there, people who understand the issue on the front lines of providing care, that we can potentially partner with. And I mentioned also the experience in Halifax, which is around student large off-campus parties. That's happening across the country. That, to me, is also an opportunity to say, let's sit down as a community. Are we okay with this? If we're not, how do we make a difference? And those discussions, I know, are happening many places. I certainly know in Halifax there's a ongoing discussions led by mental health and addictions, public health, bringing community groups, the police, universities, social service providers, healthcare providers, and many different people in communities, including, importantly, the student community as well, to say, well, how do we do this differently? And so that's also an opportunity to get into, to start to have a discussion around alcohol in its many aspects, and how do we start to make a difference? Because it's in my experience has been, it's really hard to start the discussion with communities because around doing something different on alcohol, because there's so many individual and collective vested interests and perspectives that maintaining the status quo is just much easier to do. But all these that I've just gone through, I think, are opportunities to really start that conversation about how do we do things differently if we don't like the outcomes we're getting today. So again, I'll stop there. I think Amanda, I'm not sure we have time for questions now or not, but thanks for the opportunity.
Thanks, Robert. We may save the questions for the end, but I appreciate you gave us lots to think about. And, I think a lot of that really resonated with members of the COP. I know when you're talking about grassroots approaches, I think that I think a lot of folks on the call today definitely are by being here today, I think that's definitely an important thing to keep in mind. So we'll transition over. Yes, and feel free to type any questions in the chat now, and we can come back to them in the Q&A portion. I just want to kind of keep things moving so we get a chance to hear from everyone, and then we'll have enough time for questions at the end. So we're going to move over to our panel discussion now. We have 4 panelists and our moderator, Mark Asbridge, who I'll introduce right now. Mark is a professor with the Department of Community Health and Epidemiology at Dalhousie University in Nova Scotia. He's been a co-investigator with CAPE for all 3 iterations to date. So he's another one who's been with us since day one. His areas of expertise include impaired driving countermeasures, minimum legal drinking age, alcohol, and youth. And I will turn it over to Mark now. Thanks, Mark.
Thanks, Amanda. So thank you again for allowing me to moderate. This is going to be an interesting discussion. And before I introduce the panel, I just want to, I'm on the faculty of medicine here at Dalhousie University, and the Dalhousie Medical School sits on the ancestral, unceded, and unsurrendered territory of the Mi'kmaq Nation. Peace and Friendship Treaties beneficiaries, we have a responsibility to continuously educate ourselves and work in solidarity with the Mi'kmaq and other Indigenous communities. We also recognize the histories, contributions, and legacies of the African Nova Scotian people who have been here for over 400 years. So it's my pleasure to introduce the panel. I just want to give a little brief introduction of each panel member, and then we're going to go into some set questions that I will direct to panel members to answer, and maybe to individuals, and then open it up to other panel members. First of all, our panel includes Bree Denning. Bree is a senior advisor for problematic substance use with the Department of Health and Social Services in the Government of the Northwest Territories. Bree was involved with CAPE 2.0 as a knowledge user and has been working on developing the Northwest Territories alcohol strategy. So welcome to Bree. Debbie Curtis. Debbie is a mental health and addictions consultant with the Department of Health and Community Services in Newfoundland and Labrador. Debbie was the lead consultant on the Provincial Alcohol Action Plan released in July this year, and has worked on the development of the opioid dependence treatment program. So hello, Debbie. Next is Nikki Legg. Nikki is the Provincial Director of Mental Health and Addictions with the Department of Health and Community Services in Newfoundland and Labrador. Nikki has led the development of mental health initiatives in the province for over 10 years, including Bridge the Gap online resource. Hello, Nikki. And next is Joan Johnson. Joan Johnson is a member of the Waptura Tio Spain of the Aglala Sioux Nation. She lived with her late husband Harold on his family's trapline at the north end of Montreal Lake, Saskatchewan, for 20 years prior to relocating to Gabriola, BC. With her background in justice and community development, Joan was seconded to work along with her husband Harold Johnson on the Northern Alcohol Strategy in 2016, and she continues that work today as a mentor and a consultant. So welcome, Joan. So I want to begin with the questions. I'm going to go over the first question, and I'm going to direct this question, if I can, to Nikki. And I will sort of leave it open to speak, and then I'll try and keep a time. But I think you're free to go on for, as much as you'd like here. So the question is, who were the key people involved in the strategy or action plan?
Okay, I'm going to pass this one over to Debbie. Debbie will speak to the individuals who were involved in the plan.
Okay.
Hi, thank you, everyone. It's great to be here today. Our alcohol action plan really came from a previous action plan. That's the Towards Recovery 5-year action plan. And Dr. Giesbrecht played a role in that as he presented to our all-party committee back in 2016, I believe it was. And that helped shape that the development of an alcohol action plan was one of our 54 recommendations. And so through a committee, a diverse working group with representatives from multiple government departments, including Health and Community Services, Justice, Public Safety, as well as motor vehicle registration under the Department of Digital Government and Social, Digital Government and Service NL, sorry. Tourism, Culture, Arts and Recreation Department, and also the Department of Finance. In addition to these government departments, we had community organizations, FASDNL, as well as MAD, and a peer support organization, formerly known as Channel, but it's now LifeWise. And we also had partners from Memorial University at the table and persons with lived experience. And through that working group is where we developed the alcohol action plan, and certainly consulted with the Canadian Institute for Substance Use Research, CCSA, and also our provincial advisory council, recovery council, which is comprised of people with lived experience, and our Indigenous health team. So there's a lot of partners around the table to make that action plan come to life.
Mark, if I could just add, in terms of the context in our province, I think, those are the individuals that came together to create change, but the rationale for the change is no surprise for people on this panel and listening in. And so, for example, Newfoundland and Labrador ranks highest for heavy drinking in all the provinces, according to Stats Canada. In the Canadian Alcohol and Drug Survey in 2019, 26% of Newfoundlanders and Labradorians reported to exceed the low risk drinking guidelines, compared to 23% as the average Canadians. And I mean, the list goes on in terms of additional, impacts. We have one of the highest impaired drinking rates in the country. In terms of alcohol density, I think that's the one that hits us the hardest, and we take every opportunity to explain to the public and to our partners, and certainly the individuals working on the action plan currently. According to CIHI and the Alcohol Harms in Canada report, Newfoundland has by far the highest number of alcohol-related density per 100,000 population. And so that includes liquor stores and agency stores. So in our province, we have 201 outlets per 100,000. So I'll let that sink in for a minute, because comparable next to us would be Quebec at 119. So we're at 201 for a very small province compared to Quebec at 119. And then all the other provinces are between 48 and 18. So it's a huge issue in our province. And finally, I mean, it's no surprise again with the CAPE report, most people on this call would have read it, but we had a failing grade and certainly the lowest scoring of all provinces. So that was the need for change. And certainly we were well poised towards recovery to have significant presentations provided by Dr. Giesbrecht and some of our local partners around why we can make some changes and how we can go about doing that. And so it made its way into our Towards Recovery Action Plan.
Sorry, I muted myself. That's really interesting. I'm struck by obviously you brought in a wealth of different stakeholders and within and outside government, a lot of broad range there. So that's something really struck me just hearing you speak now, is the extent to which you got buy-in from very various groups, and wisely so. I don't know if other panelists would like to also maybe comment on key people involved in their respective strategy or action plans. Only if you want. Okay, so I'm going to ask a question directed to Joan. What would you say are your key takeaways from the process you were involved in your jurisdiction?
First of all, I'd like to thank Tim for the tribute that he did to Harold. I think it's important to acknowledge that Harold was an instigator in terms of the work that's being done in Saskatchewan and indeed across Canada. And he did write a book called Firewater. The approach that he took in the book, opening the conversation and making it safe to talk about alcohol, was a key piece of the work that we did. He made it possible for people to relate, examine their relationship with alcohol, and to be able to change their stories. So we did it a little bit differently in Saskatchewan. We didn't come from government down. We came from community up. We were seconded to the Northern Alcohol Strategy in 2016. Harold, myself, and a colleague from Justice, Carla Frohog, we were all seconded from our positions to develop a Northern Alcohol Strategy to deal with the harms from alcohol in those communities. So we ended up doing a fairly extensive research into best practices and doing consultations within the community. That was a key piece. What capacity does the community have? What do they have to say about this issue? What does leadership have to say? What is it that's possible to make happen in a community? And that's where we started. I don't know if I answered your question or not, but I kind of had to provide that background in order to know where the Northern Alcohol Strategy in Saskatchewan comes from.
Yeah, so I'm taking, if I'm interpreting you, sort of just the active engagement and interchange with the community was a sort of a central piece to the process. Yeah. Would other panel members have anything to add to that around sort of key takeaways from the processes that they were engaged in? Yes, Bree.
I think our biggest takeaway from the process is just that everyone is starting from a different spot. In the Northwest Territories, we have a fairly cosmopolitan capital city with a population of 20,000 with lots of bars and restaurants. And we have communities that have no liquor store but allow liquor, as well as communities that have prohibition. And so what you want to talk about, or what people want to talk about when you go to the community is very different. And when you're talking to different leaders in a room together, not all the definitions are the same. And so it was a long process of just making sure that people are talking about the same things when they're using certain words. And I don't even know that we're there yet.
Interesting. Anyone else? Nikki or Deb?
Yeah, I think, we're just able to share kind of a snapshot of how this work kind of embarked in our province, but I wouldn't want anyone to leave thinking that our approach was from a top-down or government, and because community really drove a lot of the work in terms of an all-party committee review of our mental health and addiction system. And that kind of started the way for discussions. And I think what we're able to do, because our ministry has two advisory council, one is for mental health and addictions made up of a variety of partners, including community and lived experience, but then another committee called the Recovery Council that is made up specifically of individuals with lived experience and their family members with mental health and substance use experience. Those two councils report directly into the minister. And so they actually get to review and approve policies and our action plans as they're developed. And so I think, we had a very, nice approach where we had community kind of bringing it to the forefront. We had government partners and health authorities at the table as well, but we also had these, key individuals with lived voice at a place of decision-making power with our ministry to help make sure that we're getting it right at the same time. So I think it was a collaborative approach that way. And thankfully we had all of those sectors involved, because I think if we had hung our hat on just a government approach, or I'm not sure we would have been able to do it without community. So I just wanted to make sure, like to Joan's point, how important community is, and just acknowledge that they were certainly a big part of the success of getting this plan off the off the draft list and into the world, into the real world. Thank you.
All right, I want to ask the next question. I want to direct it to Bree. Is sort of what kinds of resistance did you experience, and from whom in the process?
So I have to tell a bit of the alcohol strategy origin story to get to this. So cut me off if I take too long. But I remember the first CAPE report when it came out, and it included just the provinces. And I actually went and said, we need to do this in the territories. This is like really good work, and we need to have it up here. And then it happened, which I was thrilled about. And then it went before the Northwest Territories Liquor Commission. And there's a tendency towards Northern exceptionalism. And there were some things that didn't necessarily translate. So for instance, outlet density really only affected Yellowknife, but in other communities, you might have one liquor store, one bar. So there's not really a way to reduce that or change that. Mystery shopper programs, when everybody knows your mother, you can't really go into the liquor store and pretend to be an age you're not, because everyone was at your birthday. So there were some things that didn't quite work out. And so their decision was, oh, well, this doesn't apply to us, which was very frustrating. And so that really, hampered the process. However, the recommendation to build an alcohol strategy went to our chief public health officer, and she went ahead with getting the funding and getting things in place. And then in the interim, we had some turnover. And so that was helpful in terms of having the door open again to reconsider this and to look at, okay, well, maybe those elements might not translate as easily into policy, but what is here that is useful and what can be done. And so that has been the focus of a lot of our work. And then I think also, not villains, but the resistance, there is a lot of AA philosophy that isn't necessarily open to harm reduction or other things. And I'd say that in terms of heroes, Joan Johnson and Harold Johnson, as well as Elder Paul Andrew, who's from the Sahtu, were really important to being able to talk to, people who had, been listening to AA hardliners for a very, very long time about those things, because I've only been here 15 years, which in the North is, you're a baby, then you don't count until you're here for 25 at least, or your whole life. And, these guys who have been sober longer than I've been alive are not going to listen to what I have to say. But when you take, people with strong traditional backgrounds, you have Indigenous voices who are saying, we need to think about evidence-based policy. We need to look at it this way. That's a really powerful voice. And so relying on those experts to bring that message was a really powerful way to move that along in the North, because we did have the detractors who said, you know what, you strong arm everybody into AA and you make them stay there till they quit. And that doesn't work for everybody. For those who it does, fantastic, but it can't be our whole approach.
Thank you. Yes, we have that heroes and villains is a term we use in this area. Any other panel members would like to speak about experiences of resistance in this process, and from whom?
I think it really has encouraged people to examine their relationship with alcohol, because people always want to point their finger at someone else and say, look, it's them, they're the problem. But really, it's about each and every one of us. It's about what our lifestyle is and how we can change that to reduce the harms that we're seeing, and to be able to develop some healthy patterns that can be influential in the community. And I think that's what the challenge is. The challenge is to be able to alter the lifestyle concept that people have bought into.
If I could just add, Mark, I think for us, Debbie and I have talked about this, and I don't know, we probably use the word resistance, a nice bit over the time that we've been working on this plan, which I might add has been over the course of 2 years during the pandemic. So it's taken a lot of effort at a policy level, and that's exhausting for partners. And so it's not that they don't want to continue the fight with us. I think it gets exhausting, and we have community partners that have to shift their attention during the pandemic. So we've, I feel like from a government perspective and a ministry, we've had to kind of lead this change with our partners, understanding that they consulted and they fed into the plan, they reviewed and approved. But to get to the finish line, we probably had to, hold this plan up for them, till we could get to the finish line. And I think it's less about, for us in our experience, about villains and more about people's lack of knowledge or complacency with alcohol in our province. I think, in our Towards Recovery Action Plan, which just ended this past March, there was one recommendation that called for life promotion suicide prevention plan and an alcohol action plan, and we called them sibling plans. And we had communities actively inquiring on a regular basis for the life promotion plan, but we didn't have the same for alcohol. But we did have some local heroes, like I can't say enough about U-Turn and Jeff Bourne, and Matt, of course, in our province. But I think for the most part, it's been our ministry that's had to hold this plan up. And I think that shows us that there's a complacency and an education piece that has to happen for us to build that groundswell of support for this plan as we move forward in the next 5 years.
And I just like to add to what Nikki was saying, like in Newfoundland, Labrador, and probably in other provinces as well, alcohol is seen as an economic and tourism driver. And not many people come to St. John's, Newfoundland, Labrador without going to George Street, which has, 200 bars. So, it's seen as a big draw for the province. And you can get screeched in and all this kind of stuff. So, I don't know if you can call culture a villain, because we wouldn't want to do that, but, that normalization of alcohol and over drinking, heavy drinking, being quite a normal part as well. And then coupled with that as being, is the new craft brewery industry in our province is, employing a number of people in small rural communities that wouldn't have had employment otherwise in that community. So I think that's one of the barriers and resistance that we're definitely up against as well.
Great, thank you. Yeah, I'm actually I'm gonna direct the next question back to Debbie and Nikki as well. Is maybe what concessions or compromises did you have to make along the way in this process?
Debbie can fill in too if I miss something, but I think we started with a very bold plan, we'll say. Is that fair, Debbie? We had a very bold plan with lots of policy drivers attached to it. But we quickly came to realize that if we were going to have our partners, which included finance, at the table with us, that we, you know, as a collective, we weren't going to all be ready at the same time for all the changes that we were looking for. So I think we took a different approach, and we talk about how this 5-year plan is our first plan, understanding that there will be more plans. This is our first opportunity to, you know, build that foundation, build that groundswell of support, make some important changes, but understanding that there's more work to come. And so I think we got to the finish line because we had to compromise. You know, that you'll look under availability in our action plan and you'll notice that it says review outlet density and pricing. That's a compromise for us. We would have liked to have been bolder, but I think in respect for our partnerships and the collaborative partnerships that we want to continue and move forward on this topic, we have to understand where they're coming from and the learning that has to occur and the evidence that we need to collect to be able to make a change. So this is our first plan, and that's our compromise.
Thank you. Yeah. Joan, I would like to ask you a question. What would be your words of advice to others working on strategies, maybe things to avoid or must-dos from your perspective?
Well, I agreed with the points that Dr. Strang made earlier in his presentation. It has to be informed from and by community. I think that's really important. There's no cookie cutter approach. It has to be individual. It has to meet people where they're at. And that means meeting communities where they're at. What kind of capacity do they have? What can this open up? Do they have the ability to be able to have the resources necessary to be able to cope with all of the things that are going to be triggered? We found it really imperative that we create networks and build on evidence-based projects that have already been around, like World Health Organization and the Canadian National Alcohol Strategy, and all of the information that's out there. I think also that informing a baseline, we worked very closely with Dr. James Irvine from Population Health to develop a baseline data, and being able to monitor and evaluate that was key, has still been key. We're now, we started the plan in 2016. It was a 5-year plan. So we're in the second 5 years of the 5-year plan that we developed for the community of the La Ronge region. And I think that that's really important to be able to measure where you're at, what's working and what's not working.
Yeah, 100%. I really take this point well about the need for baseline data. I think we, as a person who does a lot of policy evaluation work, the lack of baseline data that often accompanies the policy work that's done is a major shortcoming. So your point is really salient. Do others on the panel have a comment? Yes, Bree.
I just want to add to Joan's point about knowing what you're bringing up. You have to be aware, especially in the Northern context, Indigenous context, you're not just talking about alcohol. When you bring that into the room, you're going to be talking about residential school legacies. You're going to be talking about abuse of many, many different kinds. So making sure that those rooms are resourced, and you're like, so we had counselors at our meetings and they were really well utilized. And I think making sure that you are aware of you know, the doors that you might be opening, the Pandora's box that is coming up, because, you know, if you're going to reduce alcohol access, then what are you putting in its place to try to support what alcohol has been doing for people for decades?
Any other panelists like to comment? Okay. So I'm going to come back to you, Bree. I have a question here. This is it's not a it's a question from a CAPE perspective. And did CAPE inform your work? And if so, what did you find most useful in the CAPE resources?
The reports and the resources that were included in the reports in terms of all the papers used. I've spent a lot of time. I'm probably like 50% of the hits on that website because I've gone through all of the different the report itself was the first starting point for how we looked at things. And then we looked at the sources behind the best practices for those reports. And then we looked at sources that, we looked at those authors and the other research that had been done. And so we did a really deep dive into like, what is the underlying point? Because we have to be prepared for that because our first response is going to be, well, that doesn't necessarily apply to the north. And so how do you, what have you seen that makes you think, okay, well, this is why there is applicability to small communities or to remote regions. And this is what we've seen that's been taking place in Australia or other places with Indigenous populations that might be rural and remote. And so, so that the website, I think, has been a source of knowledge and comfort for the past couple of years. And for sure. And then just the team is always willing to chat with you about things. And so it's been great to be able to have, build some relationships and get to know the people that we've been working with so that we know where to reach out if we have a question. Norman even came up to Yellowknife, I think the day before COVID really shut everything down to talk to us. And so it's been great to have the team willing to be a resource. And we've done webinars, et cetera, to try to get to people to explain where things are coming from so that it isn't just, oh, well, what do you know? You're from the South. But there is a background to it as to why we are suggesting what we're suggesting.
Fantastic. Yeah. Do others want to comment from the panel? Yeah, Debbie.
Yes, Bree, I've studied that website and all the threads from it as well. And certainly if you look at the Alcohol Action Plan from Newfoundland and Labrador, I hope that you see the CAPE project all over that in terms of everything that was recommended and how we tried to make sure that it was included. And one of the things that was so helpful, as Bree said, is that the CAPE team was always there to support us. So we had them present about our specific results for Newfoundland and Labrador to the committee, I think at least twice, but as well, really, even from the beginning, as I said at the top, Dr. Giesbrecht presented to our all-party committee when Towards Recovery was being talked about and reviewed. So it's really provided that evidence and the credibility when we're questioned, whether it's working through the government decision-making process, which is quite an extensive process, and a lot of departments are weighing in on your plan and what you're presenting. So having that evidence was really invaluable. And for a small team that we have here in our province, not unlike Bree's, it was good to feel that you had these colleagues around you supporting you and that you weren't in it alone, that you had such great support all through, for sure.
Oh, that's great. Thank you. Nikki, what are you going to say?
I was just going to say, Debbie said that very well. The only way I can describe it is that would be like an anchor to our plan, right? Like it really helped us anchor every time we felt that a new shift was coming in terms of what was being asked of us to change or modify or pull out or add in. The CAPE report really anchored what we were able to produce. And I think it's kept the key policy areas in high focus, which was really important. So it anchored everything and allowed us to have a good product, I think, at the end.
Fantastic. Yes. As a researcher, policy researcher, I always love to hear when governments are willing and able to incorporate the evidence based in their decision making, policy adoption. So it doesn't always happen. So it's great to hear. I would like to direct a question to someone who's not on the panel, but to Opal McInnes, if I could, and if you could unmute yourself. And the question I have, Opal, is Nunavut's alcohol strategy was led by the finance division within government. And I'm just wondering if you might speak to what the role was of health in that process.
Yeah, sure. So health was engaged early on in the development of the action plan. So as a member of the advisory committee drafting the action plan, our role was largely to identify new commitments and areas of priority to support this interdepartmental initiative, because it also involved family services and justice, in addition to health and finance. There were certainly challenges with having the action plan largely led by finance, predominantly that they were not fully aware of best practices in areas of harm reduction and treatment, among other issues. And this certainly at times led to challenges in engagement with our department. However, during the implementation process and through the years of relationship building with finance, I definitely did see a shift and a greater consideration of health feedback and approaches to certain areas within the action plan. And even in other areas, the finance had needed guidance through that relationship building. For example, when they were exploring their approach to cannabis regulations, they subsequently invited us to facilitate a training for their department on cultural and trauma and gender-informed approaches to substance use. So definitely a lot of relationship building and a lot of challenges along the way, but some positive outcomes from that work.
That's great. I mean, it's a very unique situation. So it's really nice to hear a little bit about that process when there's the health and finance. There's sometimes, antagonism around directions for action and so forth. So do others want to comment on that from the panel? So a little bit unique. I do have another question, one more question. I think maybe before we open it up, is that okay? Amanda, is it okay? Yeah.
Yeah, go for it. We're actually like ahead of schedule. So yeah.
All right. So I just this is more of a positive thing maybe that it's helpful. We talked a little bit, we spent a little bit of emphasis on the resistance that is experienced, but I'd like to I'll ask Bree maybe if you could comment on maybe opportunities or champions that emerged in your process. And then I'll ask others also if they could comment on that, but I'll start with Bree. So.
I think that we've had a really good opportunity just with things coming together. So I think that, I don't want to call COVID an opportunity because we're all reeling, but just the increase in alcohol use across the population really provided a bit of more of a platform. And we saw that, in terms of our alcohol sales going up. And I think that brought it into the scope of talking about individual use, because as we've heard, it's always what they're doing, and it's the street level homeless person who's drinking in the gutter that has a problem, not me. And I think that the COVID discussions and just everyone had a chance to look at their own behavior and go, oh, wait a second. I think we align really well with the new lowest drinking guidelines coming out with going into CAPE 3.0. Locally, we had a liquor legislation review that happened at the same time. So we were able to partner and look at, okay, well, this might be, something that we want to legislate as opposed to something that's just going to be a policy or a program area. And so we had those happening at the same time. So I think it's a time that is coming together really well to have those conversations and to move this work forward.
Thanks. Yes. Others from the panel want to comment on opportunities or champions that emerged in your process?
I think in Newfoundland and Labrador, we had just finished up Towards Recovery, which had a complete governance structure in place with people with lived experience at the table, community organizations. And I guess that provided the opportunity for people to know this is how we do business, right? This is how we consult, and this is how we make sure that people who need to be a part of the decisions are at the same table. And that was a good opportunity, I think, for us, so that when we went and we're talking about the alcohol action plan, it was the expectation that, okay, that's how they're going to do it again. So this plan won't be, it's not going to be about prohibition. It's not going to be about, us telling people what to do. It was going to be that same approach informed by people who it was going to impact most. So I think that was an opportunity. And we certainly did have champions come forward, and one of the people from our recovery council, Jeff Bourne, he runs a drop-in center in rural Avalon area, and he was a real champion throughout, but certainly when it came to making sure that the policy went forward, and the action plan went forward at the end. So we were so grateful to him, and looking forward to working with him and others now as we get started in this plan.
One of the interesting, I guess, new champions we're probably going to have around the table, Debbie, is we had always planned to involve public and primary healthcare in our action plan. Like we have several recommendations that speak to how we're going to move forward in treating all substances, including alcohol, and we can't do that without our colleagues in public and primary healthcare. So our chief medical officer, has gained a lot of support and admiration from our population, and has a huge following. And she's actually going to be co-chairing our Alcohol Action Steering Committee. So we're very pleased. I mean, I think prior to COVID, people may not have known who our CMO was, but they know now. And I think so having her lend her expertise, but also her passion to this topic too, is going to be a huge opportunity for us in, building again that groundswell of support and knowledge transfer that has to happen to get this plan to the finish line and have some really good health outcomes.
And with respect to the Northern Alcohol Strategy, it's not just locally Northern anymore. It has expanded as communities have expressed interest and have the capacity to be able to look at developing alcohol management plans throughout the province. So there is opportunities. COVID has kind of put a wrench into everything, but we're starting back up again with a training session that's happening in early October that will bring together stakeholders from all over the place and interested parties so that we are all talking the same language, which is a real issue that's, I think, everywhere, that and looking at best practices. So there's lots of opportunities that are becoming available. We've gone through a rough couple of years, and I think that people are interested now and inspired maybe to be able to look at ways that we can get back and change the story.
That's great. Thank you very much for your comments. So that's really the end in terms of the sort of the directed questions I have, but we are going to switch into a Q&A. But I would ask if there's any any other thoughts that any of you would like to share with the group, or any other final thoughts that you might have. Yes,
I do just want to take the opportunity to underline how Joan Johnson and Harold Johnson really helped us get moving at the beginning. And I think that Harold's book has really inspired a lot of the conversation that we're having. It's also the gift that we give our participants in our panels. And I think that spreading out, that's going to have a long lasting legacy in terms of getting people to actually drag the monster into the light and talk about these things.
That's an excellent point. Well, just in terms of these formal questions, I want to thank you all for offering your expertise and guidance on your experiences in pushing forward your policies and strategies, and it's a lesson for all of us that we can carry forward in our own jurisdictions to try and get things moving. So I'll turn this over now to Amanda, who's going to open up for questions from the other members of the audience.